and thank you all for being here. We're doing this virtual Zoom town hall tonight because I'm in Washington, D.C. I flew back on Monday to see if we couldn't negotiate an off ramp to this government shutdown and at the same time protect our health care. So we're doing it virtually tonight, but as you know, I do a lot of town halls in person at home, and I will continue to do that. But I thought it was important that we meet during this shutdown to let folks know what's happening. As I said, I came back. All the Democrats came back this week to push for a negotiated response to the shutdown, the healthcare crisis. It's a big deal. We shouldn't be shutting down the government. We should be funding it. And we shouldn't be kicking people off of health care. And I think everyone is probably up to speed on the fact that 15 million people, because of the big ugly bill, will lose their health care. And that's going to affect all of us. The other thing at risk right now is the loss of tax credits for people who buy their health care in California, on Covered California, but the health care exchange under the Affordable Care Act. And people who do that are going to, without this tax provision, are going to see their health care increase by thousands of dollars. In California, it's about a 97% increase in the cost. So in our district, a family of four earning $130,000 will pay $14,000 more for their health care. 60-year-old couple earning $80,000 a year will pay $24,000 more for their health care. And that's important to note. So this fight is not only about opening the government, but it's about protecting your health care. And I want to debunk one issue right off the bat. We're hearing a lot from our Republican colleagues and from the White House that this is all about making sure that undocumented immigrants don't get free health care. And anybody who tells you that, I'll be very blunt, they're full of prunes. If you are an undocumented immigrant, by federal law, you are not allowed to get health care paid for by the federal government. It has nothing to do at all with immigrants who are undocumented. This is hitting Americans in their pocketbook for their health care. And if this is allowed to happen, you're going to see people filing for medical inspired bankruptcy. People will not get health care. People will get sicker. People will die. It is inappropriate. So as I said, we have a guest tonight, one of my favorite colleagues, Lauren Underwood from Illinois. And she's just a real bright spot in our Democratic caucus. And she is a pleasure to work with, and she's whip smart. She's on the Appropriations Committee, and that's the committee that really drives the funding for funding our government and all the programs that are important to the American people. She's also a registered nurse, and folks at home know that you get big points for that, Lauren, because as you know, my wife Jan is a nurse back home and works in the district. And I have just the utmost respect for nurses, and you're my second favorite nurse. And I think it's also important to point out that not only is she a nurse, but prior to running for Congress, she served as a senior advisor to the Department of Health and Human Services, and she helped implement the Affordable Care Act. So she is more than qualified to talk about these issues. And Lauren, thanks for joining us. I want to yield to you for some opening comments.
Well, Mike, thank you so much for inviting me to join this town hall tonight. I am so excited to be here with you. To our friends in Northern California, thank you for welcoming me. And you all have a fantastic congressman. He is effective, but also kind. And you guys know that is not the most common attribute that folks on Capitol Hill are known for. And it is a real delight to be here with you talking about my favorite topic, which is healthcare. For those of you who I've never met, I'm Lauren Underwood. I have the honor of representing the 14th District of Illinois. I want to reiterate my thanks to Representative Thompson for inviting me to be with you tonight and for covering everything that's at stake right now. I want to be brief with my comments so that we can get to all the questions. You all are filling up this QA really rapidly. But as Mike shared, I'm a registered nurse. I came to Congress in 2019, and making sure that people have access to high quality, affordable health care is literally my life's work. Before Congress, as you heard, I served in the Obama administration and I worked at HHS to help implement the Affordable Care Act and respond to public health crises. So, expanding that care to as many families as possible has been my mission since my very first day in Congress. And I wish that we were coming together tonight under better circumstances. It is day 2 of a federal government shutdown driven by healthcare. And I want to say at the top that government shutdowns are not a game. They cause pain and suffering for communities across our country, making life harder for working people and seniors and veterans and disaster survivors. They risk forcing service members, law enforcement officers, and first responders to work without pay, and it can disrupt our airport security and air traffic control, right? Shutdowns are serious, and the longer that they last, the more that they hurt our economy and our communities. But unfortunately, we're here tonight because Republicans have decided to put the interests of the billionaires, those guys that were in the front row of Donald Trump's inauguration, over health care for working families. And we're here because Donald Trump and Kristi Noem and Russ Vought want to use the shutdown to continue their unconstitutional power grab. And so let me be clear. Republicans have complete control of the federal government right now. They control the House of Representatives. They control the Senate. They control the Supreme Court. Don't even get me started on John Roberts. And they control the White House. They are the only ones with the power to write and pass a funding package that can keep our government open. But instead of working with Democrats to save healthcare access for millions of families across the country, or to defend checks and balances as President Trump continues to break the law, Republicans have decided to shut down the government. In fact, just today, Speaker Mike Johnson said that Republicans have, quote, nothing to negotiate with Democrats about. That's extreme and unprecedented. It's the radical opposite of the bipartisan cooperation that we value in our communities. Representative Thompson and I and our Democratic colleagues are fighting to make sure that every American family has what they need to not just survive, but thrive, to live happy and healthy lives. We are fighting to make sure that when people visit their healthcare provider, they know they will have a good outcome and they won't be forced into medical bankruptcy. And let me tell you guys, this is a real fight because Republicans have this decades-long obsession with going after our healthcare. The latest attack came this summer. You may have seen that they used their majority to pass a dangerous legislative package called the Big Ugly Bill. Y'all know what I'm talking about. This bill is the largest healthcare cut in our nation's history. It cuts more than $1 trillion, that's with a T, $1 trillion to healthcare, including the largest cut to Medicaid ever. It causes a $500 billion cut to Medicare, and it will deeply impact our families and our communities. Hospitals and nursing homes are going to close, and they will not come back. Millions of people are going to lose access to care, largely in the communities that need it the most. In addition to these devastating cuts, Republicans are refusing to make permanent popular tax credits that have made healthcare more affordable than ever, that are expiring in just a few months. These savings come from my bill. It's called the Healthcare Affordability Act, and we fought so hard to get them signed into law as part of the American Rescue Plan in 2021, and then they were extended in the Inflation Reduction Act, and we have been fighting to make them permanent ever since. These savings have been incredibly popular, and they work both to lower costs and improve health outcomes, and they've led to record-breaking and a historic expansion of coverage. 24 million Americans signed up for coverage through the Affordable Care Act this year because of these savings. And 4 out of 5 Americans have found quality coverage at just $10 or less per month. And as a registered nurse, I know the real life impact that they've had for people. They're the difference between a working mom being able to take her sick kid to see the pediatrician or just giving her child some Tylenol and hoping for the best. They're the difference between a family being able to focus on their dad's treatment after his cancer diagnosis or spending that precious time fighting bankruptcy and financial ruin. This is a lifeline for working people. We're talking about waiters and rideshare drivers and Main Street small business owners, folks who might own a dry cleaner or a coffee shop, right? These are families who are getting letters right now telling them that their premium is about to skyrocket to completely unaffordable levels. New analysis out this week estimates that premiums will more than double on average, increasing by 114% nationwide. And this is a 1-2 punch for families who are already stretched really thin because on top of these skyrocketing cuts, Republicans are letting the tax credit that helps pay for them expire. This is the crisis that Republicans have created. It will rip coverage away from millions of Americans and raise costs for millions more. So right now, if you're going to be affected, Republicans in Congress need to hear from you. So thank you again, Mike, for welcoming me to this conversation. I'm excited to be here with you, and I will turn it back to you, Mike.
Well, and thank you very, very much. And I want to start by asking you a question before we get to the questions. I'd be interested to know what you're hearing in your district. My phone rings off the hook. I hear from people, not only people who are afraid that because of the Medicaid cuts, they're not going to be able to see a doctor, they're not going to be able to get the health care they need, but from providers, the people that run the hospitals in my district, run the clinics in my district, own the rest homes in my district. They're telling me that they're either going to have to close the doors, shut down, or they're going to have to lay off people in order to keep the doors open. So about a third of my constituents are dependent upon Medicaid. But it's rather than affecting just 1 in 3, if hospitals are closed or services are cut, this affects 3 in 3, not 1 in 3. If you've got money or great insurance, if you go to the hospital to get care and the specialist that you need to save your life got fired so they could keep the door open, you're out of luck. Well, what are you hearing?
I'm hearing a simple question. What are we supposed to do? What are people supposed to do if they lose their healthcare coverage and their local hospital closes, or their nursing home that their parent or loved one is in closes? Like, what are folks really supposed to do? It's our healthcare system is a lifeline for so many people, and I represent a lot of rural communities where we've already seen extreme consolidation. Access to care has been extremely limited, and then to see this threat of hospital closures, it just is a gut punch. People know that it is not good, and the idea that they would also lose their healthcare coverage on top of that feels like it's insurmountable. And so people are reaching out just trying to figure out how to navigate this moment. And I think that the idea that we're standing firm and saying this is an urgent crisis that needs to be addressed right now and that they can see us fighting is something that at least they know that we're taking it seriously. But this is something that's really difficult for so many everyday Americans to navigate. And the more that folks in my community learn about these Republican policies, they really don't like it. The more details we share, they are increasingly horrified. And so we know that this is a righteous fight and one that we have to win.
Great. Thank you very much. All right, Melissa, are there questions in the queue?
Yes, there are. Our most liked question right now says, what is the impact of the cuts on hospitals?
Hospitals? Well, as I said just a moment ago, what I'm hearing in our district is that hospitals are concerned. They're going to have to make cuts, reducing the amount of services, the type of healthcare that they provide, or they're going to have to close the doors. This is $1 trillion that they're taking out of healthcare. And if that happens, it's gonna devastate all the healthcare that we have, and not just the healthcare that we think about. You go to the hospital with a broken arm or appendicitis, but there are all types of ancillary programs that save us money and help people that are paid for or reimbursed through Medicaid, and that's services that keep people out of jail, addiction services, domestic violence services. If it weren't for those, it would be a much more expensive response because people would otherwise be in jail. Lauren, if you want to pitch in, go ahead.
The only thing I would add is that even if you yourself don't have Medicaid, or even if you get your own healthcare coverage, maybe from your job, and so you don't have an Obamacare plan, this threat of hospital closures can be very deeply personal and impact you, right? Because we're in a healthcare system. And so that means that everybody in the community is seeking to get care from the same place, and they're bringing the coverage that they have. And so a lot of times, folks who have Medicaid are sitting right next to you in that hospital waiting room if you visit that emergency department. And that hospital oftentimes relies on those timely reimbursements from these key federal programs. And so Mike is absolutely right. Taking out $1 trillion from this healthcare system means that 9 hospitals in Illinois are slated to close. And we know that there are hundreds of nursing homes across the country that will close. And the thing is, friends, like when these facilities close, they are not coming back. And so what it ultimately means is more Americans will die. They'll go without the treatments and the surgeries and the prescription drugs and the cures that they need to live healthy, well lives. And that is cruel, and it is an active policy choice. And I want folks to really remember that the Republicans chose billionaire tax cuts over our health care.
I just add a couple of other things. And if you have a policy, as Lauren said, through your employer, or you buy a policy on your own, those prices are going to go up too, because people are going to be sicker. There's going to be more impact on the healthcare system in general because other people don't have, people lose healthcare and Medicaid. They're still going to be part of our community. If they get injured or they become acutely ill and they go to the hospital, they're going to be seen and they're going to be taken care of. They just won't be reimbursed. So the cost is going to have to be spread out to the paying customers will pay more, which means those insurance policies will pay more as well. And just one other thing. Somebody told me the other day, they said, yeah, this is really tough. Hospitals are going to hurt, but we've got to balance the budget. And again, anybody who tells you this was done to balance the budget is full of prunes, because the big ugly bill, in addition to all the things that have already been said, added $5 trillion to our national debt. This wasn't about balancing the budget. As Lauren said, this was about giving tax cuts to people who don't need a tax cut in this environment. Melissa, next question.
The next question is, what are your thoughts on how the Democratic Party will recover from such a low rating?
Well, I think that the Democratic Party is probably seeing some increase in its rating right now, given what's happening in Washington, D.C. And the optics, the juxtaposition is pretty clear. These guys want to add to our national debt, take away your health care, to give tax cuts to people who don't need it. And on the other side of it, Democrats are fighting to make sure you have health care, make sure we open the government and fund the government so it's operational and working. So I think you're seeing a pretty good example of how hard Democrats are fighting. I'm in Washington, D.C. I'm looking for Republicans. Somebody had a milk cartons with Mike Johnson's picture on it. They aren't here. The Republicans did not come back. They adjourned the session of the House and sent everybody home on vacation. It was Democrats who came back to fight for the American people.
I just add that for a lot of folks, they just want their life to be a little bit easier. They want things to feel a little bit better. And for too many people in our country, rent is going up. It is really expensive and keeps going up. Gas is really expensive and keeps going up. Groceries are really expensive and keep going up. And healthcare for too many people has never felt affordable. And so now they're learning more about this big, ugly bill and learning more about this fight that's happening in Congress. And I think that people are really disgusted to see the president showing such indifference, to see the Speaker of the House saying that, healthcare is an issue that can wait several months, right? Wait till the end of the year. Like so many of us can't wait. We don't have that luxury of waiting. And so, it's my hope for that individual who is feeling, a little bit down about our country and down about, their own economic situation and their prospects to see us fighting for them. Like we see you and understand that things need to be better and you deserve it to be better. And we're working hard on your behalf.
And you're spot on about not being able to wait. On Monday morning, the notices go out in regard to the increase in premiums. And that's why this is so urgent. That's going to have a devastating effect. Even if we figure out and get the Republicans to work with us and figure out how to stop that from happening, those notices are still going to go out. It's still going to put people at ease. It's still going to increase anxiety and cause people to worry. Okay, Melissa.
How long do you see the shutdown will run?
I don't know that anybody has an answer to that. I don't think it's going to be as long as the last one. I'm kind of going out on a limb here. I could be all wet and wrong on this. But the last time this president was in the White House, he initiated a shutdown that lasted, I think, 37 days, the longest shutdown in the history of the country. I don't think it goes that long, but I suspect it probably runs through this next week. And there's already talk in the Senate of a bipartisan working group trying to figure out how to address these issues pertaining to the tax credits for the Affordable Care Act. So hopefully they'll be able to make some progress. One of the stumbling blocks is that the last time we had an agreement between the Democrats and the Republicans, between the House and the Senate, it was signed into law, and this president clawed back the funding that was established in law. And so there's a big trust gap in Washington. You need to have people who can work together, negotiate agreements. Then you have to stand by those agreements. You don't turn around and cut those funds or do away with what it is you just agreed with. So that's a little bit of a rub. This is not going to be a wink and a nod. There's going to have to be something substantial that guarantees whatever is negotiated is going to be the law of the land.
And I'll just add that, Democrats are ready to sit down and have a conversation. We saw Leader Jeffries and Chuck Schumer in the Oval Office with the president on Monday. And that was the first time the president had engaged in this conversation. And then the government shut down at midnight the next day. I mean, and to see the president leave that meeting and post such a disgusting, ugly meme that they have continued forward gleefully all week. I mean, these are not serious people. And when you think about the hundreds of millions of people whose healthcare hangs in the balance, and all the president wants to do is post a sombrero meme, I mean, it's just horrifying. And so, again, I'll just reiterate, like, shutdowns are not casual. They are not harmless. They are not fun. That's not how you like resolve small differences, right? Shutdowns happen when there is a complete breakdown. And that is what we have all witnessed on full display this week. And, I hope that the president decides to get serious, because we're all waiting for them. We're all waiting for them to sit down and seriously engage on this life and death issue, which is the healthcare for the American people.
And remember, Lauren, before they had that meeting this week in the White House, they had another one scheduled last week that the president canceled. So this isn't something that Democrats haven't wanted to do. We were ready to meet a week ago with him, and he's the one that pulled the plug on that.
I mean, he's Mr. Art of the Deal. We're like, let's make a deal, Mr. President. And they just want to post memes. It's crazy.
Okay, the next question says, how confident are you that more Democrats won't give in to Republicans or will compromise to reopen the government out of fear that Trump will do more harm?
Well, I don't think what's happening with this president and threatening to defund quote unquote democratic programs and democratic agencies and fire the people who are in the quote unquote democratic agencies is anything new. He's been doing this since he was elected. They cut thousands of personnel. They fired thousands of veterans, both in the Veterans Administration and in other agencies. They have single-handedly tried to bring a wrecking ball to the Congress. So this isn't new. And remember, in the campaign, when this was pointed out that this is what he was going to do, implementing the Project 2025, and that he was going to bring on Russ Voigt to do that. If you remember what he said, he said, I don't know what Project 2025 is. I've never read Project 2025, and I don't know who Russ Voigt is. Well, number one, he was in his last administration, and he's the guy that's doing all the cutting now, implementing Project 2025. So I don't think these threats are anything new. And it's hypocritical for him to say it's important to fund the government so we can provide all the things that the government does, but I'm going to cut all the things that the government does. It makes no sense. Those are not dots that you can connect.
I just add, we can only do our part. And you have Representative Thompson calling in tonight from the United States Capitol, doing his part, right? We're here at a town hall meeting, talking with all of you, making sure that everyone understands exactly what we're fighting for. And I think that members of the House Democratic Caucus have been doing the same thing in their communities all across the country over the last several days. And, I think in the House, Democrats are united and, are very clear about the stakes. And, we are continuing to encourage our Senate colleagues to stand up for the healthcare of the American people and to do the right thing. And I hope that these negotiations can restart with the president in earnest very quickly, so that we can save our healthcare and have a strong bipartisan vote to reopen the government and move forward doing the work of the American people.
Someone asked, Congresswoman Underwood, how will the government shutdown affect Medicare and Medicaid in Illinois?
Okay, so the government shutdown doesn't disrupt folks' ability to see their health provider, for example, if they have Medicare or Medicaid. okay? Because those programs are funded differently than the annual appropriations process. So for seniors on Medicare or our community members who have Medicaid coverage, please, if you have a doctor's appointment, go get your health care. You know what I'm saying? We are fighting for you to make sure that the cuts that the Republicans have planned cannot go in effect and harm you. But don't let that disrupt the care that you're slated to receive this week.
I'll just add to that. Lauren's absolutely correct. But there is one provision in healthcare that has been affected, and it's not because of the shutdown per se, but and it's a provision that's near and dear to me because it's my legislation that made it happen, and that's telemedicine. And during COVID, we took a bill of mine and passed it that allowed people on Medicare to get their health care through telemedicine. And it was wildly successful. We wanted to make sure seniors weren't around a lot of people and to run the risk of being exposed to COVID. So we extended the telemedicine provisions in my bill. So wildly popular that we've extended it twice since. And we're trying to make it permanent, but the extension ran out, and the Republicans have not allowed that expired program to be continued. So we're still working on that. It's a great program, saves money, saves lives, and it should be permanent.
And it's so convenient. That little notification pops up. You open your app, you talk to your provider. You don't miss the appointment. I mean, we need to make sure that we're, continuing to make sure that all Americans can get the health care that they need. And this essential program needs to be reauthorized. Thank you so much for flagging that for us. And I understand that this question came from Charlie. So hi, Charlie. Thank you so much for being on the call tonight.
Laura, interesting what you said about convenience, because when I first started working on telehealth, I was in the state Senate. And I passed the first bill that allowed for reimbursement for non-face-to-face meetings with your healthcare provider, and that's what got telehealth started in California and then across the country. But the whole emphasis was telehealth for underserved areas where you didn't have the healthcare access that you have. But with COVID, what we found was the convenience thing that you just mentioned. People in big cities say, this is great. I can get my kid to soccer. I can stop and pick up the laundry. I can shop. I can do my job. And it's a real convenient way to stay healthy. So
absolutely.
Important.
Somebody asked, what can we do to stop this government? People are aware of all the serious violations of the Trump administration. Protesting does not impact them. What can citizens do?
Well, I think protesting can. And I've said it a number of times. It was people in the streets, people in the exercising their right in the court of public opinion, and the rallies and the protests that got my butt out of combat in Vietnam. And there's plenty of examples. It was in the court of public opinion that changed the route of the civil rights movement, the Vietnam War, and you see it now with the No Kings rallies and all of the different protests that are taking place across the country. And it's important to exercise your First Amendment rights. It was protests that stopped the Trump administration from silencing Jimmy Kimmel, speaking of First Amendment rights. So it is wildly important. We're watching it with public broadcasting right now. This administration is responsible for mass funding cuts for public broadcast, which it's just so incredibly important, not only for First Amendment reasons, but if you're in a rural area, that may be the only way by which you get your information. If there's a disaster in a rural area, it's the only way to communicate oftentimes. And the outcry against this and the folks donating money to keep public broadcasting going is a real welcome sight to see. So public involvement is important, and the more you speak up, I got to tell you, I think Lauren probably agree with me, but I got to tell you, there's nothing as powerful as the voice of your constituents talking to you. And when you have the will of the public, as Abraham Lincoln said, you can accomplish just about anything. But without it, it's impossible to accomplish anything. So don't sell short your voice. Don't sell short your participation, and get involved, stay involved, and make sure that you don't agonize, organize, and join groups and be participatory.
I would also just add that we have to remember that this Congress, under the leadership of Speaker Mike Johnson and these MAGA loyalists who are in charge, are doing no oversight. The Trump administration is not being held accountable at all. Mike Johnson, John Thune, and Chief Justice Roberts have completely yielded to Donald Trump, and they are content with expanding executive powers and indulging him as he wants to be a king. So the only way to stop that for real, Mike's absolutely right. We have to raise our voices, but we have to have a Democratic majority, friends. And I think that we have to be clear-eyed about the strength and the power that a majority that's willing to reaffirm checks and balances, to assert the power of the legislative branch under Article 1 of the Constitution and what that means, and making sure that we have the ability on behalf of our constituents to hold the president and these officials accountable when they violate federal law and our constitutional rights. But that requires a majority. And I think we have to just be honest about that.
Well, Lauren, have you been holding in-person town hall meetings?
Absolutely.
I have too, and the reason I figured you had, and the reason I asked that is because on the other side of the aisle, Speaker Mike Johnson told the Republicans, don't have town hall meetings. Don't hold them. Stay away from public meetings. And I think that is indicative of the fact that they're hearing, they don't want to hear from their constituents, but it is important that you speak up and you make your voices known. In California, we're doing something that is, in addition to all of that, we have in November a special election to pass Proposition 50 that is in direct response to this president and the governor of Texas trying to rig the midterm elections. And it's incredibly important. Texas stole 5 Democratic seats in the Congress, and California stepped up and said, we're going to get them back. And that's what Prop 50 does. It will temporarily change how we redistrict the state, and we will add 5 Democratic seats to make up for the 5 that Texas stole. Melissa?
The next question says, will I still get my Social Security check if the shutdown continues?
Yes. Social Security checks will continue to go out. Social Security is the most successful program at the federal level. I would argue at any level of government. It's been no one's missed a check. No one's been short on their payment, and that will continue to go. It is important to note, though, that 12% of the Social Security Administration employees have been furloughed, and 88% of them right now are working without pay. So there may be some slowness in certain areas, but you will get your check.
Somebody asked, is it true that undocumented workers pay into taxes and Medicare and Social Security, but will not be eligible for any of those benefits?
So undocumented immigrants are not by law, they are not allowed to have Medicaid nor Affordable Care Act benefits. They do not get them. The law says that undocumented immigrants can't get Medicaid nor ACA tax credits. And Democrats are not asking that that law be changed. We're just demanding that we save the ACA tax credits to stop Americans' premiums from doubling. And it's important to note that, yes, on Social Security, undocumented immigrants, I believe they contribute $25 billion a year to Social Security, and they are not eligible to get it. So they bolster our Social Security system. They do not take anything out of Social Security.
On that note, someone also asked if the ACA tax credits aren't extended, what will happen to the rates?
They'll go up. They'll go up, as I was saying earlier, covered California consumers. They'll see what Covered California tells us is a 97% increase in their premiums. And I think I gave some examples of a family of four earning $130,000 will pay $14,000 more. I think it was a 60-year-old couple making $80,000 will see I don't remember what it was, $24,000 increase in their premiums.
This is a comment, but maybe you guys can touch on this. Someone said their concern is funding for university research.
Yeah, it's because I'm not going to be able to be there. I did a video today for the Alzheimer's walk that we're having in our district. They do that every year. I've been to most of them. But I did a video welcoming everyone, and I talked a little bit about that. In our congressional district, we have the University of California at Davis, and they do incredible research in a lot of different fields. In agriculture, for sure, it's top agricultural university in the world, and also in healthcare. They do a lot in child cancer research and in Alzheimer's research. And these grants, research grants that were cut, are just devastating for a whole bunch of reasons. One, it stops in its tracks any research that's being done. And it's not like flipping a light switch. You can't turn research off and on. So much goes into that. So once you disrupt especially a medical research program, you don't just start it back. It's probably gone forever, or certainly not. It's not done at the high level that it should be. And it also sends a message to college students who want to be researchers. They're watching where the money goes. They're watching where the jobs are going to be. And if they're cutting funding from medical research, students know that they should that medical research is probably not an area of great job growth. So they're going to do something else. So this is really devastating, and it's a bad thing for our country and the people in our country.
Federal workers have been furloughed and fired all year. Why is this shutdown any different than what has been happening for the last 9 months?
Well, I kind of alluded to that earlier. This is what this president has been doing. Between this president, Russ Vought, and Elon Musk, they've been trying to disassemble the entire federal workforce and all the good things that come from it. So you could argue that we've had a partial government shutdown since the day he was sworn into office, and you wouldn't be wrong. This is the immediate fight right now, and we need to make sure we figure out a way to fund the government, but we're not going to do that at the expense of healthcare. And then we need to continue to work on trying to reverse a lot of the problems that he and Elon Musk created. And I want to point out, maybe Lauren, you may know the answer to this. I've been trying to find out. We've heard so much about all this waste, fraud, and abuse that Elon Musk and Donald Trump have ferreted out of the federal government, but I haven't seen any place where anybody has been charged with fraud. And if there's so much waste, fraud, and abuse, that's a violation of the law. And if you're guilty of fraud, if you're committing fraud, you ought to be charged with it. I haven't seen anybody charged. Have you?
I've not. And, Mike, it's a real shock that they would lie about that. Yeah, call me stunned.
Yeah, it's right up there with the 130-year-olds who are collecting Social Security.
Exactly.
Someone asked how the cuts are going to affect people with cancer.
Well, as I said, the big cuts in that regard are the research grants, where we're trying to find a response to some of the terrible diseases that we have. If it's the memory research that's done at UC Davis, Alzheimer's research, or if it's the children's cancer research. There's other, Lauren, I'm sure you have universities in your district, certainly your state, doing important medical research. And anytime there's a cut to this, it just sets us back decades, and it's not good for medicine. It's not good for healthcare. It's not good for the people who need that type of research and those types of treatments.
Someone asked, how are you getting your message out to Republicans and independents who are not tuning into mainstream media?
Well, I do a lot. As I say, I'm here in Washington, and I've been doing videos explaining what we're doing. Been doing podcasts. I'm on every social media platform: TikTok, Instagram, digital content creators. I just met with one yesterday. Lauren has a very important role in our Democratic caucus in regard to messaging, and she is a social media icon, rock star, and I think everybody is probably finding new ways to communicate better, and I'm one of those. And so I do all of the traditional stuff, the press releases to the TV, radio, and newspapers, but I do all of the social platforms and the podcasters. I had a podcast guy in the office just this week who is a veteran, has a podcast deals with veterans. And he was in my office and interviewed me. And then we have somebody local who is a podcast icon, who was a former Capitol police officer that now has his own podcast. And he interviewed me this week as well. So I'm doing all that. What are you doing, Lauren?
Well, what we know is that the average American is no longer really interacting with the journalist ever. They're not watching local TV. They're not getting the local newspaper delivered to their house. And so we have to do all the things that Mike has outlined in order to make sure that people who want to hear from us, who need to hear from us, are getting the information. And so we're trying to create content at volume so that we are showing up in everybody's feeds and explaining exactly what's at stake and what we're fighting for, and making sure that people understand this Republican healthcare crisis and how we get out of it. I mean, I think that it is essential. And I was over here just giving some snaps to Representative Thompson for showing up on all the platforms and embracing vertical videos and, really just being an exemplar in that way, to show up and engage people in a way that's comfortable for them. And so we've been doing a mix. I'm in Illinois today. We've been doing a mix of in-person and virtual digital engagements, talking with the creators, creating content of our own, and making sure that we're showing up for people across the 14th district.
We should have time for one more. This one is more of a comment. It says, no question, just want to say thanks for all you are doing. And that's the one we'll end off on.
Well, you're welcome. But is there another question? We probably got one more question in.
That was our most liked question. Our second most liked question after that one is, how do Dems counter the news that the shutdown is associated damage that the Dems are not doing? We really, really need to publicize the truth and counter typical propaganda.
Well, as I said, I've done a lot to try and dispel that. I've done a number of short videos. I've done a number of social media posts. I posted today the law that says if you're undocumented, you do not qualify for the ACA credits, nor do you qualify for Medicaid, and it's the law. And some of the responses are you're a liar. You're trying to give money to undocumented. They don't call them undocumented. They have a derogatory term for them. But the facts are the facts, and you can read it. You can go on my on any of my social media platforms that I use. Then you can see the post. You can read the law. If you don't believe what you're reading that came from me, take the code section, go to the law library and read it yourself. Or if need be, take somebody with you who can read it for you and explain it for you. But it is, in fact, the law that if you're undocumented, you don't qualify, period. Is that it? All right.
I think so.
Well, Lauren, thank you very, very much. It's always a pleasure to be with you. As I told the viewers earlier, you're a pleasure to serve with. Your constituents are really lucky to have you. You're whip smart, you work hard, your values are great, and you're a real ally. And thanks for joining me tonight. And to all the folks from my district and from Lauren's district who are on, thank you. And if you need anything, either one of us are a phone call away. Contact our offices and we'll help any way that we can.
Thank you, Mike, for having me. It's such a treat to visit with you and talk about healthcare. My favorite days in Congress are healthcare days. And this is a fight that we can win to cancel the cuts, lower the costs, and save our healthcare. Thanks, everybody.
Thank you. Thank you all very, very much. Melissa, good job. Thank you.